Hello dear friends, welcome back. Friends, we are discussing about the anatomy of the human respiratory system. Now this was our previous lecture about the introduction of the lungs, right? In these lectures we are recording about the anatomy of the lungs. Previous lectures we discussed about the nose, the nasal cavity, the pharynx and the larynx. Now our previous lecture before this one was about the parts of the lungs, that is the apex of the lungs, the base of the lungs we discussed, and the borders of the lungs I have discussed in the previous lecture. Now here in this lecture we are going to discuss about the surfaces of the lungs, right? So friends, the surfaces of the lungs are the costal surface and medial surface. Costal surface is towards the costal bones and medial surface is towards the mediastinum, right? Now the first thing about the costal surface, it is large, smooth and convex, right? This one which you can see, these are the costal surfaces and these are the medial surfaces, right? So costal surfaces are large, smooth and convex, right? It is covered by costal pleura and endothoracic fascia. So these two surfaces are covered, this is the right lung and this is the left lung, are covered by the costal pleura and endothoracic fascia. Okay, what are the relations of the costal surface of the lungs? It is related to the lateral thoracic wall. Yes, there is a medial thoracic wall and there is lateral thoracic wall on both sides. Okay, then the number of ribs related to this surface are as follows. So friends, we say that in the costal surface there are impressions of the ribs, as the ribs are covering the lungs, you can see here, right? So our ribs are covering the lungs, so these ribs put some impressions on the costal surface of the lungs, right? This is the costal surface towards the ribs, and here if you follow the cursor of this marker, this one towards the mediastinum, towards the heart, these two surfaces are the medial surfaces, right? So what did we say? We say that the costal surface is smooth, large and convex surface. Okay, it is related to the lateral thoracic wall. It is embalmed, hardened lung. Okay, the costal surface presents impressions of the ribs. On the surface of the costal surface there are impressions of the ribs. The number of ribs related to this surface are as follows: the upper 6 in the mid clavicular line, the upper 8 in the mid axillary, right, and the upper 10 in the mid scapular line, right? So when these ribs come in contact, these two lungs, right and left, so they put some impressions on the surface of the lungs, on the costal surface, right? So costal surface is mostly related to the ribs, so they contain impressions of the ribs. So these, at the mid clavicular line there are the impressions of the upper 6 ribs. In the mid axillary line there are impressions for the upper 8, and in the mid clavicular scapular line there are the impressions for the first upper 10 ribs, right? Then what about the medial surface of the lungs? So this one is the medial surface. If you turn the lungs, this right lung in right side and the left lung in left side, so you will see the medial surface. The medial surface of the lungs is divided into two parts: a small vertebral part which is little bit posteriorly, right, and a large mediastinal part which is little bit anteriorly, right? So this small part, right, this one is the vertebral part and this large part is the mediastinal part. So once again we say that medial surface is divided into vertebral part which is little bit smaller and mediastinal part which is little bit larger. Now what are the structures in the mediastinal surface of the right lung, and what are the structures in the mediastinal surface of the left lung? Let us see it here, right? Now the structures which are related to the mediastinal surface of the right lung are the impression for the right atrium, or we say the right atrium of the heart. Then superior and inferior vena cava, superior and inferior vena cava are there, right? Then there is ascending aorta, the branch of ascending aorta goes up, right? Then there is azygous vein, you can see here, this is the azygous vein. Then there is right brachiocephalic artery, this one, right, vein, right brachiocephalic vein. Then there is esophagus and trachea, this one is trachea, and here you can see esophagus, right? Then there are 3 neural structures, right? Only 3 neural structures are there, right? The right phrenic nerve, right? This one is the phrenic nerve. Then the right vagus nerve, right? Here you can see this is the vagus nerve, and the right sympathetic chain. There is right sympathetic chain also. So in this picture that is not represented, okay, like this. Okay, so the medial sinus surface of the right lung is related to all these structures, right? So we discussed about the surfaces. There are 2 surfaces, costal surface and medial surface, right? Costal surface, important points. Medial surface is divided into vertebral part, which is posterior, and mediastinal part, which is medial and anterior. And the mediastinal surface of the right lung is in relation to all these structures. Now the mediastinal surface of the left lung is in relation to all these structures which are shown in this picture. Now we will see all those structures. Look carefully, friends. There is the left ventricle. So not all the left ventricle. So we say that the left ventricle of the heart is in relation to the mediastinal surface of the left lung, right? There is ascending aorta, right? You can see there is ascending aorta also. Then there is arch of aorta and descending thoracic aorta. The arch of aorta, and this is descending thoracic aorta. Then there is left subclavian and left common carotid. The left subclavian vein is there, artery is there, and left common carotid artery also there. So these 2 are the left subclavian artery and left common carotid artery. There is esophagus and thoracic duct. This is the esophagus, right, and there is the thoracic duct. And then there is 4 neural structures which are in relation to the mediastinal surface of the left lung. These are the left phrenic nerve. This is left phrenic nerve. Then there is left vagus nerve, right? This is the left vagus nerve. Then there is left recurrent pharyngeal nerve and left sympathetic chain. So these were the structures which are in relation to the mediastinal surface of the left lung. So in this lecture we discussed about the surfaces of the lungs, right? The costal surface and the mediastinal surface. I hope you have learned something from this lecture, and the relations of the mediastinal surfaces of the right and left lung. In the next lecture we will discuss about the root of the lungs and structures which are present in the root of the lung, and then the arrangement of all those structures. So see you dear friends in those lectures. Till then, Allah Hafiz.